Good morning, ladies and gentlemen. Those of you who know me well know that I read scripts rather poorly, and since I'm in an official role this morning, I'm required to read my script. So I will do that rather poorly in just a few minutes. But I want to say a couple things off the script. So those of you in the room who are keeping track of me getting government in trouble, this is where you should pay attention. On November 28th last year at a conference on primary care, Minister Hoffman delivered much more than the usual customary opening remarks. She delivered what is a vision for healthcare in Alberta that really represents an effort to encapsulate what many of you in the room have been thinking about and writing about and worrying about for quite some time, and that is really a pivot from Alberta's historic, unusual reliance on delivering care through big institutions like hospitals and long-term care facilities to a community-based care and a home care model. And if you have not read the minister's speech, then you should do so if you're interested in what the government of Alberta is thinking about over the next several years as an evolutionary path for the healthcare system in Alberta. This is significant for many reasons, and once you read the minister's speech, you'll see exactly how far-reaching her thinking has gone based on the input of many of you in the room and based on some very early work John Sproul did with the government of Alberta just after they took government. The other comment is I had originally planned to spend the whole day, but Treasury Board called last week and asked whether we were ready. Of course, when Treasury Board calls and says, "Are you ready?" there's really only one answer, because what they really mean is, do you want a budget or not? So I'll be spending all of today in and out of Treasury Board because rather than spreading us out over several weeks, they've packed the entire health budget, capital, operating, and everything else into a series of hearings today. And you'll have some sympathy for me, and when I say I would very much rather be spending the day with you here. And that's not just a throwaway comment, because I'll be spending my day with all of the Ministry of Finance experts defending the health budget and struggling to capture the funding that we will need to implement the minister's vision. So, back to script. Good morning. I'm pleased to be here to see so many people gathered today I'm in my role, that are interested in building more efficient and patient-centered healthcare systems. I'd like to thank the Institute of Health Economics for organizing this forum and bringing people from around the world to share their perspectives and expertise. And I might add that John played really quite a remarkable and important, if somewhat invisible, role in me becoming deputy minister once I was appointed, understanding the many issues, and a lot of what the minister said in her speech you can trace back to the conversations that John organized for the minister and her colleagues at an important point, December 2015, I think it was, John, right? Although every jurisdiction has its own unique difficulties and opportunities, getting better value for our healthcare system is a goal we all share. Because when we get better value for our healthcare systems, we can save costs and are better able to meet our patients' needs. By gathering together today, we will learn from each other's challenges and successes and generate ideas about how to increase the efficiency of our healthcare systems while continuing to provide quality care to our citizens. In Alberta, we are facing the challenge of a significant recent economic recession, and pressure to increase efficiency in our health system is ever present. Projections from the Canadian Institute for Health Information showed the Alberta government spending on health would rise from $19.7 billion in 2015 to $20.5 billion in 2016. That's an increase of more than 4%, but we will point out that the historic average increase over the last 15 years is 6%, so that in fact the health system in Alberta is bending the almighty cost curve down rather than up. With inflation at 0.2% and Alberta's population increasing by 1.8%, a 4% increase in health spending is clearly a challenge for government. We need to bend this cost curve while also improving the quality of healthcare services, which means finding ways to get better value for the money we spend. In order to get good value for investments, government and health administrators need to do several things. We need to set clear evidence-based standards and performance expectations. We need to implement these standards and expectations by developing processes that support efficient and patient-centered care. And we need to monitor this performance of the health system to evaluate whether the standards we set are working and to learn lessons to be applied. As Alberta's Minister of Health has stated, our goal is to provide the right service in the right place at the right time with the right team of providers, and in particular who have the right information in order to bring all the pieces together. How we organize and fund our services is an important component of achieving this goal, and I'm pleased that there will be a focus on this with the program today. To achieve greater value in health, I know I need to set clear expectations within the limited dollars and then actively engage in listening to workers who are on the front lines of healthcare delivery. These workers know where there are gaps in healthcare delivery, and opportunities to improve the efficiency of healthcare system are known to them. And the CEO of Alberta Health Services and I spend quite a lot of time traveling around Alberta, meeting with teams of frontline healthcare providers and mayors and county officials, and the ideas we collect are really quite valuable. Creating a more integrated system that supports information sharing will assist healthcare professionals in making the evidence-based decisions that are necessary. In Alberta, we've been doing many things to create a more integrated healthcare system. We have a single health authority, Alberta Health Services, which strives to make sure Albertans receive the same quality of health care regardless of where they live in the province. And I'm convinced after 2 years or so as Deputy Minister that 10 or 15 years from now, Alberta will look back on the creation of Alberta Health Service as a singular positive event in the long-term evolution of healthcare in Alberta, and we are now at this stage where we are beginning to harvest those benefits. Alberta's Ministry of Health is also looking at ways to get better value from the healthcare system. Minister Payne, our Associate Minister of Health, announced last week the turning on of a personal health portal which will give patients online access to their health information. And we know this will be successful because we are already being pulled into a debate about how much information should we allow people to enter through their own health portal. So we've already skipped the question of whether this is a good idea, and we're now in a much more technical, detailed conversation about how much is the right amount for patients to enter on their own behalf. And it's a conversation I will eavesdrop on, but probably not weigh in on. The long-term goals of this health portal are to enable patients to have greater access to their healthcare team and to services such as consultations and prescription renewals. In addition, the ministry has established a standards, quality, and performance division to actively lead the development and monitoring of health system standards, and we've just announced the appointment of the Assistant Deputy Minister to that post. Developing standards for our health system and monitoring their success will help us build a cost-effective health system that meets patients' needs. Another initiative the Alberta government has undertaken to improve our healthcare system is our recently signed agreement with the province's physicians, and Michael Gormley, who is the CEO of AMA, is here today. And if you have any questions about what a magnificent agreement he signed, you should ask him, because it is magnificent. The agreement includes an evidence-based improvements committee which will enable the government to work collaboratively with doctors on making improvements to the healthcare system. And the teams working on the implementation of the agreement have moved very, very rapidly to meet the expectations and the goals. So in conclusion, I have a brief overview of a few strategies we're working on in Alberta to get better value from our healthcare system. Over the course of the day, we will hear more details on these strategies, as well as examples from other jurisdictions that show how we can build efficient, high-quality healthcare systems. So thanks to all of you for being here and taking the time to share your knowledge, ideas, and questions with each other. There are many people in the room from the ministry as well as AHS, the AMA, and many other relevant organizations like the Health Quality Council of Alberta. I hope the conversations we have today will inspire us in our efforts to get better value from our investments in healthcare. By setting consistent standards and expectations, collaborating with frontline healthcare providers, creating an integrated health information ecosystem, and monitoring our progress, we can build financially sustainable health systems that add value for our providers and patients. So those are the official remarks, and as I head over to the Capitol building, I invite you all to channel all positive energy. They've renovated the Capitol building. There's a new lightning arrestor on the top, so you now have a point of entry for all of your psychic energy. Treasury Board meets on the 3rd floor in the cabinet room, so if you want to target your psychic energy, that's the place to send it, starting at, let's say 10:30 or so. So thank you, John, and thank you all for coming, and if I can get back during the day, I will certainly do so. Thank you.